If you've ever wondered whether there's a real way to increase your size, you're not alone. This is one of the most common questions I receive, and behind it often lies real anxiety, confusion, and the weight of comparison. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you're navigating questions about penile health, whether it's about size, function, or confidence, stay with me. We're here to help you understand your body with clarity, compassion, and medical honesty. Today, we're going to walk through what science actually says about penile lengthening, what works, what doesn't, and what you need to know before considering any treatment. Make sure you subscribe so you can stay informed with new content every week. Let's start with something important. How you feel about your body matters. But it also matters that those feelings are based on accurate information, not images shaped by unrealistic media or comparison. A large survey involving over 50,000 men revealed something striking. More than half, about 55%, expressed dissatisfaction with how their penis looked. But when researchers asked their partners, 85% of women said they were satisfied with their partner's appearance. That disconnect tells us a lot. Often the distress isn't about reality, it's about perception. Pornography and media have deeply distorted what's considered normal. So let's ground ourselves in facts. What is the average penile length? According to comprehensive data, the average erect penile length is approximately 5.2 inches, or 13.2 centimeters. What's considered medically normal falls within about 2.5 standard deviations of that average, meaning there's a wide, healthy range. A penis is only considered clinically short if it measures less than 2.9 inches, or 7.5 centimeters, when erect. This condition is called micropenis, and it's exceptionally rare, affecting fewer than 0.14% of the population. Micropenis can result from hormonal issues, congenital conditions, prior surgeries, or certain medical treatments. But here's the key. Most men concerned about their size fall within the normal range. Small penis anxiety, a real psychological condition. What many men experience is something called small penis anxiety, a form of body dysmorphic disorder. It doesn't mean the penis is actually small. It means the person is consumed by the belief that it is. This anxiety is defined by spending more than an hour a day preoccupied with thoughts about size. For some, it becomes debilitating, affecting relationships, daily function, and mental health. In severe cases, it can lead to hospitalization or even suicidal thoughts. This is not trivial. This is a genuine mental health concern, and it deserves to be taken seriously. The danger of misinformation. When someone searches online for ways to increase penile length, they're often flooded with unverified claims, miracle products, and offers from unlicensed providers. Some people travel abroad seeking procedures that can lead to permanent damage, disfigurement, or loss of function. That's why I want to be very clear with you today. Most procedures advertised for penile enlargement are not supported by strong medical evidence. In fact, the Sexual Medicine Society of North America states that penile lengthening or girth enhancement procedures are not recommended and are considered experimental, except in cases of true micropenis. What I'm about to share with you comes from medical literature. It's what we know based on research. But please understand, before pursuing any of these options, you should work with a board-certified urologist who specializes in this area. Why do men seek penile lengthening? The reasons are layered. Some men feel inadequate due to comparison. Others have experienced comments from partners that left lasting wounds. Some grew up with shame around their bodies. And some simply internalized cultural messages that equate size with masculinity or worth. But here's what I want you to understand. Your value as a person and your ability to connect intimately with a partner is not determined by measurements. That said, I also recognize that when anxiety is real, dismissing it doesn't help. So let's talk about what options exist, what the evidence shows, and what risks you need to be aware of. Non-surgical options. 1. Psychological counseling. This is the most important starting point. There are validated assessments that can help you understand what's truly normal and work through the anxiety that's affecting your life. What's remarkable is this. The majority of men who undergo psychological counseling alone no longer seek physical treatments. Once they gain perspective, the distress often resolves. If you're struggling with this, I strongly encourage you to seek support from a psychologist or counselor who understands body image and men's health. 2. Penile traction devices, extenders. These are mechanical devices that apply gentle, sustained tension to the penis over time. They consist of a base, 2 metal rods, and a silicone holder that supports the glands. The idea is that gradual stretching may stimulate tissue growth. Studies show that with consistent daily use over several months, often several hours per day, some men gained approximately 2 centimeters in length. But let's be honest, that's a very modest gain, requiring significant commitment. And there are risks, including numbness, bruising, and in some cases, no benefit at all. 3. Vacuum erection devices. These devices create suction to draw blood into the penis, leading to temporary engorgement. However, research shows they do not increase penile length over time. 4. Penile injections. There are various substances that have been injected into the penis with the promise of increasing size. The problem? Many have led to devastating complications, including disfigurement, scarring, and loss of function, sometimes decades after the injection. I do not recommend penile injections. The risks far outweigh any potential benefit. Surgical options. Several surgical techniques have been described in medical literature, but none are recommended for routine use. Suspensory ligament release. This procedure involves cutting the ligament that anchors the penis to the pubic bone, theoretically allowing the penis to extend further outward. While it may provide a small increase in flaccid length, it often comes with complications, including loss of erectile angle and instability during intercourse. Other surgical techniques. Some surgeries use grafts, flaps, or even rib cartilage to attempt lengthening. Unfortunately, outcomes have been poor, with low patient satisfaction and high complication rates. The studies reporting these procedures often lack rigorous methodology, making it difficult to assess true safety and effectiveness. What about clinical trials? The only appropriate context for pursuing penile lengthening surgery is within a clinical trial overseen by an institutional review board, IRB. These boards ensure the research is ethical, safe, and that outcomes, including complications, are carefully documented and published. This transparency allows the medical community to evaluate whether a procedure is truly beneficial or whether it poses unacceptable risks. Here's the truth. There is no quick, safe, magical solution to significantly increase penile length. Penile traction therapy may offer modest gains with consistent use, but it requires patience and realistic expectations. Everything else currently available either lacks evidence or carries serious risks. But before you consider any physical intervention, I encourage you to explore the emotional and psychological roots of your concern. Work with a professional who can help you see yourself clearly, not through the distorted lens of comparison or shame. Your body deserves respect, your mental health deserves care, and your worth as a person is not measured in inches. If you're facing distress around this, please reach out to a urologist or psychologist. You don't have to navigate this alone. Thank you for trusting me with this conversation. Next week, I'll be discussing the history and risks of penile injections in more detail. Make sure you're subscribed so you don't miss it. And as always, take care of yourself because you are worth it.